I am Jill Upson, Executive Director of the Herbert Henderson Office of Minority Affairs. Today's honored speaker has spent more than 2 decades serving the community through his ministry, his addiction treatment centers, as a licensed mental health and substance misuse disorder provider, and in radio broadcasting. After being selected to serve on the state's COVID-19 Commission on African American Disparities in early 2020, he led a statewide Communities of Color project, delivering on increased access to healthcare services in West Virginia's most underserved regions. In addition to his experience as a nonprofit leader and community change agent, he has been a pastor for more than 32 years. And reflecting on the connection between both areas of the work that he loves, he remarked, "The Black church is still the focal point and the center of the community. Black churches carry a legacy of trust that cannot be denied even today." He received his BA in Sociology from West Virginia University of Technology and an MA in Sociology from Marshall University, and a Master's of Arts in Applied Community Change and Conservation. He was also the 2022 recipient of the Governor's Martin Luther King Jr. Living the Dream Award. Ladies and gentlemen, the Herbert Henderson Office of Minority Affairs is proud to present Reverend James Patterson on health equity.
Hello, my name is Reverend James Patterson, and I'm the CEO of the Partnership of African American Churches, and we operate Infinite Pathways Treatment and Recovery Centers. Today, I want to talk to you about equity, particularly health equity. And the first thing that I want to say is that most people really do not have an accurate definition or understanding of equity, nor did I. I thought equity was equality. And in this year, a lot of people even still think that equity is equality, even though there is a tremendous spotlight and a tremendous response, particularly to COVID-19, that has to do with equity. I spent some time in India, and it was there that I set up late at night arguing with a young man by the name of Manoj. And he and I were arguing about equity and equality. And believe it or not, it turned out that Manoj was correct and I was wrong. What Manoj convinced me of is that equity is simply applying the largest amount of resources to the largest amount of need. Let me say that simple definition again. Equity is applying the largest amount of resources to the largest amount of need. And we don't always get that right. An example is the challenge that we're having now with COVID-19 and the disparities that exist, particularly in communities of color and people of color. They are having a more traumatic experience and a more complicated experience, as well as the numbers are disparate as it relates to the number of people of color that are actually contracting COVID. And I like to say that COVID is just the current pandemic as it relates to health outcomes of people of color. And one of the main reasons is because of the social determinants of health. And those are a lot worse and a lot more challenging in communities of color. And the social determinants of health are simply described as where a person is born, where a person lives, where a person learns, where a person works, where a person plays, and where a person even worships. Those indicators can determine how well one does as it relates to his or her health outcomes. Health equity, though, arises from the social determinants of health. So if one does not have access to health care, if one does not have wealth, and I'm not talking about millionaire wealth, I'm talking about enough wealth to provide for one's daily needs and one's daily requirements. If one has power, if one has prestige, all of these go to whether or not a person will have good health outcomes. Individuals who have consistently been deprived of these three or more determinants are specifically disadvantaged from health inequalities and face worse health outcomes than those who are able to access certain resources. That is why when it comes to resource allocations, we have to deal with equity and not equality, because a lot of the population, particularly the people that I care about and the people that I live with, the people that I work with, are disparate as it relates to access to these social determinants of health. So instead of just being concerned about where a healthcare provider is located or the cultural competency of the healthcare provider or many other indicators, we need to be concerned about these social determinants and how do we address these in populations that are experiencing poor health outcomes. It is not equity to simply provide every individual with the same resources. That is equality. But if we're going to talk about equity, then we have to circle back around to the original definition that Manoj pounded into my head, and that is allocating the largest amount of resources to the largest amount of need. I read a request for a proposal from the federal government, and what that proposal said was, in the request for funding, it said that they wanted to ensure. Now, this was supposedly an equity grant. It said that they wanted to ensure that each and every person, each and every organization had equal access to the resources. That, my friend, again, is not equity, that is equality, but it goes to show, it's an example of why we are talking about equity but not implementing it, because we don't have a good understanding. In order to achieve health equity, resources must be allocated based on an individual's need-based principle. I will say that again. If we're going to achieve equity, then the allocation of resources have to be based on an individual's need-based principle. Let's just think about why people of color experience so much of a challenge in terms of, let's take a look at why people of color face so many challenges when it comes to achieving equity as it relates to health outcomes. Let's talk about COVID-19. Most recent data shows that Black Americans are dying of COVID-19 infection at disproportionately high rates. In a study in 2009 that was done in Pittsburgh, patients of Black parents were twice as likely as white parents to distrust medical research and medical facilities. So that is one of the huge challenges that we have to overcome. And when I say we, I'm not talking about people of color. I'm talking about the existing healthcare system in the sense that they are the ones, and those of us who practice healthcare have to be concerned about the distrust and its origin that people of color have. That's another thing that we have to exhibit equity in, and that is in our approach to the populations in which we serve. In 2020, during COVID, these are just some examples. In 2020, during COVID, the pandemic, black inmates in Arkansas were given cocktails given to horses to cure COVID-19. Now think what that does when that news gets out. Physicians use slaves as subjects of abusive involuntary medical experimentation for both developing cures and profit. Early medical journals during those times commented on black inferiority. And someone says to me, why are you talking about those things? Believe it or not, the people of color still remember those things. I remember since I've been married, my wife got 4 checks, and they were in the neighborhood of $50 or $55. And I asked her, why are you getting these checks? And their family is originally from Alabama, and her grandfather was part of the Tuskegee experiment. So we got $200 because payment because he was involved in the experiment. And so people say, well, why is there still such a mistrust? It's because people still remember and people still experience a disproportionate treatment when they access medical care. And so I am saying to all the providers that will hear this, that you have to exercise equity in terms of going the extra mile to make sure that your patients that you are seeing and servicing understand that you understand who they are and their journey to where they are now. The U.S. medical institutions have a long legacy of discrimination and exploiting of black Americans. The haunting remembrance remain ingrained in the collective consciousness of the community. Let me tell you a personal story. I am old enough to have grown up during segregation. And someone always says, don't bring up all of those old stories. But the physician that we saw when I was a kid, it was a segregated waiting area. In other words, there was a waiting area, a waiting room for whites, and there was a space down the hall for people of color. And believe it or not, all of the white patients were seen before the black patients were seen. And if it happened to run out of time, then you had to come back the next day. And someone said, Patterson, why are you talking about that? I am trying to help the modern day medical establishment and treatment providers and practitioners to understand where their patients are coming from and what challenges that they may have in providing the services that they are trying to provide and the challenges that their patients may have from any perspective in terms of being a little leery of how they're going to be treated. So we have to go the extra mile. Remember, Equity is the concept of providing more resources for a more amount of need. And this need may not be in terms of the actual medical services. It might be in the way that one is approaching their patients and the way that the whole entire atmosphere of the provision station is operated. Equity means that we remember and we understand our past and make a concerted effort to correct them by taking an equitable approach to delivering health care to those most in need and are experiencing the worst health outcomes. And that is the situation that we're facing here in our beloved state, and the people that we care most about are experiencing. Remember, there is a need in West Virginia that we establish healthcare centers where people, not only of color, but West Virginians, period, can go and feel comfortable when seeking medical care and medical help. Thank you.
What an amazing presentation. Thank you, Reverend Patterson, for speaking to this critical topic and sharing your knowledge with our viewers. Thank you to all who are joining us, whether you're viewing on the premiere or watching on the replay. We appreciate you and encourage you to share this video so that others can share in your experience. Please keep an eye on our website, minorityAffairs.wv.gov, and on our social media pages with the handle @WVHHOMA for future announcements about all of our upcoming events. We look forward to seeing you again soon. Until then, God bless.